You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, smile makeovers. There is a new technology, a new technique where patients on the same day can walk in with bad teeth, walk out with a beautiful smile. With us, we have an expert on the topic. He is Michigan's cosmetic dentist, Dr. Pittsley. Dr. Pittsley, welcome to the program.
Randy, thank you for having me in today.
So you've been doing smile makeovers for quite some time.
Yes, I have.
How long have you been?
Over 25 years.
25 years. Now, for people that don't know your practice, who's a typical patient and what are the different services you offer?
Well, Randy, there really isn't a typical patient. The demographics are all over the board. Everything from cleanings and fillings for little Sally and Johnny, all the way up to grandma's dentures. We do bleaching. For some people, all they need is a little bleaching and it changes the way their smile looks. We contour teeth, you know, those vampire canines that people don't like.
Yeah.
We can change the shape of those and again, entirely change a smile. For people that have those flat, square teeth, a lot of women want rounded, more feminine looking teeth. We do implants to fill spaces so people can smile naturally and chew food the way they'd like to. We do crowns, veneers. Most of the veneers I'm doing these days, Randy, are no prep. People don't want their teeth cut for lots of reasons. One of those reasons is there's going to be better materials coming down the line. In the last few years of my practice, the materials have changed dramatically.
So like they're very thin, this material?
Like fingernails that women get on their hands to change the shape of their nails, they're that thin.
Okay, so veneering, typically, when you say no prep, you normally have to carve down the tooth structure to put a regular veneer on there.
Yes,
is that right?
Yeah, you have to cut teeth away.
So what you're talking about is you could take your existing teeth and just cover them
with very tiny pieces of porcelain or composite bonded material. Absolutely. And we can get them the same day result. So if I'm doing direct shear side composites, they come in with their old smile, they leave with the new.
Is that right?
Transformation in a
So
day.
they could do it in one day?
Oh.
Even on the first appointment?
Generally we have to plan it, and that's some of the technology that's involved.
So maybe 2 trips?
2 trips. Absolutely, yeah.
So is this a game changer for you? Like this new type of veneers or this new type of teeth?
It's huge for me, Randy, for lots of reasons. First of all, I didn't do a lot of veneers because I didn't feel comfortable cutting down a healthy tooth to get a shade change and change the shape of teeth. Because I knew, being a dentist, that those weren't going to last forever. And once I cut those teeth, they're going to have to keep coming back in for procedures. The no prep veneers, I don't have to cut those teeth. And not only is it easier to change them later, but it gives them opportunities to use new materials that'll be coming down the turnpike, new technologies. You know, I'm from Michigan, the automobile state, and it's been rough trying to get people their smile dreams the last few years.
Because they couldn't afford it? Oftentimes?
Yes, yeah. The economy was a huge hit, but people still want to be the best person they can be, and they want their dreams. So what am I going to do as a dentist? Some of these cases where you do full mouth reconstruction, you're doing crowns on 20 to 30 teeth, thousands of dollars. My patients didn't have that as a choice, so I had to find ways to get them their dreams without them having to spend that money, or to give them an opportunity to spread it over a few years. No prep veneers, direct composites, let me do it. In fact,
it's affordable cosmetic dentistry.
Very affordable cosmetic dentistry. And I can spread it over years in many cases. So we get them the dream over a period of time in a way that they can afford to have it for them.
Now, you've had a lot of training.
Lots of
when
training.
It comes to this.
Oh yes, lots. It's years.
Is there a lot to this?
There's a lot to it. Imagine sitting down. It's sitting down chair side and creating teeth for people in a day. It's years of training to get that. There's layering, there's shading, there's tints. So we have to make the tooth look natural, and it's not easy to do that. It's what the porcelain technicians do in crowns. We have to do chair side while the patient's there.
Now you're a dentist, so you probably think that the smile is pretty important. How important is the smile?
Randy, the smile is, they say that eyes are the windows to the soul. Smile is an expression of the soul. What you can look into somebody and see who they are. When they smile, you find out who they are. It comes out. So American Academy of Cosmetic Dentistry did a survey, and it said 92% of people felt that their smile was one of their key social assets for their life. It affects not only how people see you, but how you see yourself. So it's an expression of who you are from the inside. When somebody's in love, what do? They smile.
Okay.
When they're successful, what do you see from those people? A smile. When they're on a job interview, who are you going to hire? Person with a beautiful smile that comes in and smiles from the inside out, or the person that hides their smile and doesn't really express who they are? Well, that same study that I talked about earlier from the American Academy of Cosmetic Dentistry, 88% of people in the study said that someone with an unattractive smile was less likely to be appealing to someone from the opposite sex.
Interesting.
74% of people believe that an unattractive smile changes your career success. So success, romance, your charisma. When you walk in a room, you're mostly covered with clothing. What do people look at? What do you look at?
That's a good point, yeah.
You look at their smile.
If somebody's smiling, they're approachable, right? There's no doubt about that.
Yep, they're inviting. They're inviting you into who they are. It needs to come out freely for people.
Do you see transformations? That means people that you have fixed their smile and they're different?
Oh, all the time. In fact, they smile different. These people come because they're in a different spot, or they want something different for themselves. They want the world to see who they are.
What do you mean a different spot?
A lot of the people come in, they're going through divorces. I've had people that have had cancer and they're cured, and they realize they're going to live to the fullest the rest of their life. What's the very first thing they want to do? They want that smile for themselves.
Good.
They want people to know who they are. And it's easy to do with these no prep veneers. I can get that for everybody.
With these new no prep veneers, I mean, you just put them on top of their teeth. Is that correct?
Yeah, most times. Sometimes we have to contour a little.
But you can just put right on top of their teeth.
Yep. Shapes. We can change colors. We can change shapes.
So people that couldn't afford cosmetic dentistry in the past now can do it.
Absolutely.
Is that right?
Oh yeah. Yep. It's dramatically less expensive because I'm taking a process out of the procedure, a laboratory technician. So yes, we can do it for less.
You brought photos.
I did.
What are we going to look at here?
This is a young man who went through ortho. At the end, he wasn't entirely happy with his smile.
Looks like a good smile.
It's a beautiful smile, but he knew that he wanted something a little more than that. Came to us through the orthodontist who sent him in. We merely changed 2 teeth and changed entirely the way his smile.
So when you look at him, on that before, what do you think needs to be changed?
Oh, it's easy, Randy. I've got training. You can look and see. I knew this would be a home run. This is so easy to do in a day. We did this in a day. He came in fact, in less than a day, part of a day. We got him, we changed the 2 teeth, and he left a different person. He's growing into young manhood. He wants a smile that looks like a man's smile. Change 2 teeth. We line them up. We get the right shape. Now they look like they're proportionate. An entirely different smile.
Yeah.
Simple to do. Same day. Randy, here's another one. And again, this is a beautiful smile, a beautiful young girl. Wasn't happy with the final result. Why do you think that is? Look at the color and the shapes on these
So that's
teeth.
as white as her teeth are going to get?
And that's with some bleaching, okay? So what are we going to do to fix that? Simple. Same day result. We bring her in. We get her the shapes that she wanted. We get the colors that she wanted. And when she got up and smiled, it made it all worthwhile. That we get the same response every time we do this.
What do you mean?
Every time we do one of these transformations, it's amazing. And you'd think I'd get used to it, but I don't. It's the best part of my job. We hand them a mirror. And the very first thing they do is pause. You know what? They're a little afraid of what they're going to see. They know there's going to be a
Oh, is that right? So they're a little bit worried.
They're worried. Think about it. They're changing. And they know, that's why they're in my chair, that this is a huge part of who they are. It's what they present to the public. So this is their charisma that we talked about later. This is an opportunity for romance. This is an opportunity for a job. So they're nervous when we give them that mirror.
Yeah.
And then they take a peek. So they take that first look, Randy, at that new smile, the first day of the rest of their life. And it's always the same. Wow. That's the word that comes out of their mouth. Wow. And then it's generally tears, and then I get hugs. And I mean, everybody in the room is crying. My assistant will have tears. Sometimes even I get a little
You still
teary.
get choked up here?
I do. It's the best part of my job. It's what I've trained for my entire life. It was my dream when I went to dental school. You know, when I went to dental school, it was mostly technical stuff. We used gold, we used silver, and as hard as I shaped it, as hard as I carved those silver fillings to look like teeth, they didn't look like teeth. I wasn't satisfied. Years later now, we have technology and materials that let me not cut teeth, not have patients wait. I get them results in the same day, beautiful changes in their mind.
So it's not an exaggeration when we hear like same day smile makeover, whatever.
Not at all.
So you can do it. And not a lot of guys are doing this minimal prep or no prep veneers.
Well,
super thin veneers.
It's demanding both technically and artistically. Yeah, I had a art scholarship when I was in grade school and considered being an artist. One of the bad parts of dentistry was, you know, I've got to make it, everything's got to look like a tooth. So in the old days with gold and silver, you know, there wasn't a lot I could do, and I maybe wanted to, but I didn't get there. Nowadays, it's an artistic expression, shapes, colors. For women, I'm going to match their smile to who they are. So
is that right?
Part of the process is I get to know these people. Now, a lot of them are patients I've had for years in my general practice. Some of them get sent in, and the very first thing we do is have a discussion with them. What's their dream for themselves? What do they want for themselves? And,
what do they say?
You know, if I can get them to really talk to me, and that's the goal, okay, I get a story. And that's what every one of these is for me. It's not a mouth, and it's not pretty teeth. It's a story. It's somebody's life that I get to change, okay, help them get what they want. And so what they tell me in there eventually is who they are and, you know, what their dream is for themselves. We have a box of tissue in the room because for some of these people, it's an emotional.
Is that right?
Oh yeah, tears. You know, when we put in these transformations, I think of it as setting who they are free. Some of these people have never smiled the way they want to. They've never let that expression of who they are come out. I think of their existing smile as like the bars of prison, okay, that's not letting them come out, who they are. When we put in that new smile, that comes out. Imagine if you were let out of prison and you'd been in prison your whole life. There'd be a few tears, wouldn't there, Randy?
We had a conversation on the phone about teeth. And that if you want to look your best, that veneers or what you're doing is inevitable. Elaborate on that.
Well, you know, Randy, the years of wear that we see for people, their colors change. You know, if you live long enough, eventually this is going to be something you're going to want for yourself. And like I said before, this is so easy. I'm not cutting teeth. I'm not having to have you spend thousands of dollars. We can get this for you easily. And everybody wants to look their best.
I always feel like I could spot veneers walking down the street. But when you see those big, giant veneer look, like on TV or whatever, right?
Oh, yeah.
California, we're known for this.
Oh,
right?
yeah.
Everything's over the top.
Yeah, no,
Whose idea is that? Is that in the hands of, is that the dentist's fault? Is that what the public wants?
No, I think that's what used to happen for people. You had to have a thickness of material to get the color, and the shape. And we don't, with modern materials, we don't need that anymore. We can do it with
But it's still going on. I still see it.
Oh, yeah. Yeah, no, it is. I had a patient. We did a case for her. And again, a special moment in her life. Her daughter's getting married. She came in about a year ahead of the wedding. They're making wedding plans. She wants that beautiful mom smile. Okay. Transformation. We changed across the front. After the wedding, they had friends that came in from out of town. And they said they were out to dinner, and she said, I could see his dentistry, those little white chiclets. And he was going on and on about how beautiful his new smile was. I hate to say it, Randy, he was from California.
Okay.
And she said, he said to her, he goes, but you wouldn't know about that. He goes, you've got a beautiful natural smile. Okay. Best compliment I ever got.
That's good.
He didn't know that. She goes, I had as much work as he did, and he had no idea.
So if it's a good job, it should be undetectable.
No. In fact, a lot of times I'll tell people, friends of yours are going to say, something's different. You look great. What's going on? And I'll say, fix your hair, do your makeup, change something, and tell them you've just had your hair done. And they'll go, yeah, that's it. You look great.
Okay, good. Time for a few more photos. What else do you have?
Well, let's see here, Randy. This is another transformation.
What a nice smile. That's her before
Gorgeous
photo?
smile. And she, a pretty woman. And she got compliments on her smile all the time. And she said that. She wasn't happy.
But she didn't like that.
She did not like it. If you take a look, see how these are squared off?
The front two teeth, like they're square?
Front two teeth. Okay. Actually, they're cut. They go in a reverse direction, not a natural direction. And they're very square, not feminine at all. So she didn't like the shade. She knew she could get whiter teeth. So same day result, put her in the chair, work a little magic, little artwork.
It's very nice in the after.
Oh, she was thrilled. And if you take a look at her smile, look at the before.
Yeah.
See how it's compared to the after, how she's holding back here. And you can see it in the smile. This is another story you can see in the before. That's after ortho. What bothered her were if you take a look at the teeth on either side of those, the ones in front, the centrals, they're a little small. They don't fit with the rest of her smile. So again, same thing, same day result. We actually shaped and colored the front 4 teeth, changed the shape of those 2 teeth, and again, a different smile. And Randy, take a look.
Yeah. Because
in the before and after, that's a different person. No, a lot of these people, Randy, are people that are going through changes in their life. A lot of the women come in, they're going through a divorce, and they're going to be back out in the dating world, and they want to be, they want to meet that somebody special. They want to meet that person that's going to change the rest of their life, and they know that the very first thing people look at, smile. They're going to see who she is. So right away they come in. They want to change their life.
Is it called no prep veneers? I mean, is that what you say, or no prep?
Yeah, it's
no
a little.
Prep
That's a hard.
composites?
Yeah, it's a hard concept to get across for the patient. It's really kind of like the fingernails that they put on for women. They're that thin, and we bond them in place. But it's little tiny changes to the teeth that we make that. Like I said, most times we don't have to cut the teeth. A lot of times there's no anesthetic, and most of the time we can get them the same day result.
Now with this before and after right here, I mean, it's a small difference. At the beginning when I looked at that before photo, it looked like, she already has a great smile.
Yeah, she does.
But it's a good point. When you just make that little tiny difference, it's
4 teeth, little
looks
tiny
very
additions.
Sophisticated and finished and very nice. And they're not big.
No, the idea again is to look natural. I don't want anyone going, who did your dental work? That's a bad.
When it's all done, do they ever say that? And if they're already a patient of yours, maybe for cleanings, do they ever say, why didn't you talk me into doing this earlier?
Yeah,
do they ever say that?
Well, if they don't, I do. When they get done, I'll go, I bet you wished you'd done this a long time ago. And you see, we've got some kids in there, and some of the young people these days get it. They want that for themselves as early as they can. And again, it's going to affect who they get to meet to have for the rest of their life.
So if you don't like your smile, just come in, find out the options.
Find out the options.
It's a free consultation, right?
Absolutely. Yep. And so I always say, if you look in the mirror and you're not 100% satisfied, if you don't feel confident, if you don't see who you want to see, come in and talk to us.
Now, I mean, at the top of the show, I said, Michigan's cosmetic dentist, but you've been doing cosmetic dentistry for a long time. I mean, you built, I understand, quite a reputation.
I practiced in Chicago some with actually one of the gentlemen who helped develop the material, real famous dentist over there to get the training. I taught at University of Michigan for 17 years.
Oh, is that right? Okay.
Yep. So, it's a lifelong commitment to this. I'm living in the best time to be a dentist ever in the history of the world. I get to do things that other dentists have just dreamed about doing. It does take a lot of skill.
To make it look right or natural.
To make it look right and natural. Yep.
Good, and you love it.
Absolutely, my favorite thing in life. Randy, I would do this without getting paid. Don't tell anybody that. But when I see that wow, when they put that mirror in front of themselves, it's the best feeling ever.
It's worth it. Okay, good. We have time for a few more photos. What else?
Now this is a young man, and lots of wear. You look at this, how short these teeth look.
Yeah. Okay. Good point. They're small and flat.
Yeah, they're flat. And that can come from stress. Actually, we treat sleep. We do sleep therapy these days because what research has shown is that people grind their teeth when they have sleep disordered breathing. For whatever the reason, when they get worn like that, it ages your smile. So again, this person realized that and came in. Length, shade, we actually opened their bite. And again, we can all do this. This one was 2 days, 2 visits, because we had to open the bite first, and then we added.
What does that mean, open the bite?
Well, when you grind, you close, And if you've ever seen that person with bad dentures, where it looks like their chin is touching their nose, that's because they've lost what the dentist calls vertical dimension. You add youth and beauty when you give them back that natural
So you make
dimension.
the teeth a little bit longer?
We do. And so we even open the bite because they've ground away all their teeth. So we open the bite, and that makes it very easy to add length to the teeth. I'm thinking of another young man who came in similar circumstance, and he was kind of a quiet guy, came in, went through the process. We did get a wow when we were done, but kind of a quiet wow. There weren't any tears. A week or so afterwards, his mom, who's a patient, came in, and she grabbed me as I'm going down the hall, and she said, Dr. Pittsley, I haven't seen my son smile like that since he was a young teenager.
It's nice.
Oh, it's way better than nice. How do you think that makes you? Here's a mom who's seen her son the way she saw him when he was a teenager. What a great feeling. But the story gets better. A little bit after that, we get a call from the young man. He'd been sort of looking. He wanted to ask a young woman out, and he lacked the confidence to do it. And he said he felt his smile looked old, aged him. New smile. He told the staff he'd asked her out. They were going to dinner on Friday. So what a great
That's
story.
Good.
And this
Great.
Is one of the interesting things about this, Randy. It not only changes the way people see you, it changes the way you see yourself. So mom saw her teenager that laughed and smiled real easily. She got to see that person that she saw when he was a young man. He saw himself differently, gave him confidence to go out and address the world the way he should. He's a great guy.
So for these no prep veneers, would you say there's tens of thousands of people just in your town that hate their smile or don't like their smile that would be great candidates for this? Then what's your take? Why aren't they all doing it? Is it they think it's more than it is? Is it just they don't like the dentist, right? Nobody likes the dentist.
Well, no one likes the dentist.
Do you hear that today?
Oh, goodness, yeah.
What do they say?
Well, it's one of their first questions is this going to hurt? That's they ask that before they ask how much is it going to cost. Okay,
Is it gonna
so
hurt?
yeah, is it going to hurt? And these are very simple to do. A lot of them we do without anesthesia. The other concern, of course, is cost. And in Michigan, that's been a big challenge for us. But here we get to do less pain, And
What else do you have? And we're short on time.
this is interesting. This is an executive, a woman. She's a get-it-done type of person. She came in. She knew she wanted something different. She knew she could get something different. She said, no ortho. That was because I said right away, well, can we do ortho? Absolutely not. She wanted it now. So, no prep veneers, one day. Yeah, it's a gorgeous smile. She's a beautiful woman. But I'm going to show you again, Randy. Take a look. Before smile isn't nearly as open and approachable as the second smile.
So is she holding back, in your opinion, on that
Absolutely
first before
holding
photo?
back. Yeah, these people know that they're not who they want to be. They know their smile isn't what they want.
That's an impressive one.
Can I show you one more?
Yes, yes.
All right. This is a young man, again, done with ortho and realizing that he wasn't entirely happy. And if you look, there's a little gap.
The little gap in the front teeth.
Yeah, and see the square teeth?
Yeah.
Before they were straightened, he ground them in a
Looks like
a
a
way.
good smile, though.
It's a nice smile, but he absolutely wasn't happy. Wasn't
Okay,
happy at all.
all right.
Talked about having the ortho redone. I said, we can do this. You don't need to go back into bands. One day, we do a no prep situation and change him, get him what he wants. Take a look at those smiles, Randy.
Very nice.
Before, after, they open up.
Same
They
day.
smile. Same day. All right, Randy, and I want to show you just one more. And again, this one is a porcelain case. She had porcelain existing already, and knew that she could get a better situation for herself. So there's a couple of implants in there, new porcelain, new shade, new shape, more feminine, and again, take a look at those before and afters.
Very
Randy.
nice.
Yeah, it's exciting. Best part of my life.
Good job here. We're out of time. Final message. Somebody watching this, they don't like their smile. Or maybe their spouse doesn't like their smile, their partner. What do you say to them?
Give us a call. You want to find out what your options are. When we meet with people, we call that conversation choices. Find out what your choices are, because it's easier these days. We can get it to people quicker. We can get it to them for less. Don't go through another day of your life not smiling the way you want to.
Good job. Thank you again for coming on the program.
Thank
Very
you,
interesting.
Randy. I appreciate it.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.